This mural on the wall inside the offices of the Belize Cancer Society holds the names of persons who have lost the fight against cancer, but it is no indication of the real number of persons afflicted with a non-communicable disease. Cancer is a problem. It is the leading cause of sickness and death across the world. In Belize, 14% of deaths are due to cancer, and the figures, according to nurse Laura Longsworth, are damning.
2013, 14, 15, each year is approximately 200 new cases every year of cancers. Now that does not provide you with the prevalence, those persons who are living, and then of course you have cancer deaths. And that cancer deaths can range anywhere from 160 to 200 deaths.
While the data provided by the Ministry of Health does not include private sector patients or persons going overseas to get medical assistance, the leading cancers affecting men and women are clearly defined.
The data is also clearly indicates, clearly shows what are the leading causes of cancer, deaths and morbidity in Belize. You can't miss it, it's there. For men, it's prostate cancer, and those numbers are high. They're as high as for women have their leading cancer is cervical cancer. Both of them are very high. For men, of course, lung and digestive tract cancers. For women, is cervical cancer, breast cancer, and the other cancers that are similar to men. So that's our situation. And of course, you know, we have our children with cancer, and we know that we've just from tracking, we have at least 2 new patients being diagnosed every month. We give or take, it might not, it's on an average, might be less, might be a little bit more. And so that exists. So cancer, like diabetes, like hypertension, is a problem.
Part of the campaign includes working along with other agencies such as the Belize Family Life Association to reach out to the community, encouraging men and women to get screening done. It's a frightening experience, but it is confidential and private and takes little to no time.
In light of World Cancer Day, we're pushing the pap smear screening. And for men, they can come in and do their testicular check or their prostate exams. One of the things I would like to do is applaud the men that have been accessing our services and encourage other men to come in and you know, find out what's going on with your health. Only you can take control of your health, you know. So we have several services ranging from the STIs, pap smear, prostate, urine exams, a complete blood check, you know, and we have centers in the different districts. We have in Dangriga, we have one in San Ignacio, Belmopan, and Orange Walk. We also have the NHI clinic on Central American Boulevard. So if you're registered with NHI, you can access that services, or you can also come here and sit with the nurse, and she could give you some counseling, offer some advice, offer some kind of method or service that you can access.
While there is no known cause for cancer, President of the Cancer Society says that the public needs to become proactive.
What we have to do is to get to work. And in the whole direction of non-communicable diseases, it is recognized. We need all of society to make an impact, to reduce the numbers of all those diseases that are being diagnosed and that are killing us. So all of society, all of government, all of us together, you are here today, the media play an important role in addressing non-communicable diseases and particularly cancer.
The theme for this year's World Cancer Day is I Can, We Can, but the Cancer Society has adopted the theme We Can, I Can. Understand that early detection saves lives. Dwayne Moody for News 5.